Welcome to White Coat Voices. In today's video, we'll explore a vital topic in mental health care, the comprehensive management of depression. From treatment settings to relapse prevention, let's uncover how we can best support individuals on their path to recovery. The information gathered during the assessment of a patient with depression forms the foundation of their treatment plan. The goals of depression management include deciding on the appropriate treatment setting, educating the patient and their family, providing a supportive environment, minimizing risks of harm, using effective pharmacological treatment, ensuring an optimal quality of life, and most importantly, preventing relapses. The choice between outpatient or inpatient care is critical. Severe depression, psychotic symptoms, agitation, or risk of self-harm often warrant hospital admission. Patients who live in isolated areas may also benefit from inpatient care. However, most patients are treated as outpatients. During the acute phase, frequent follow-up is essential, allowing for timely adjustment of medications and continual risk assessments. While some may manage to continue working, others may need medical leave to reduce stress and promote healing. Many patients mistakenly believe depression is a weakness they must overcome alone. Others don't realize it is a treatable illness. That's why education is key. Patients and families should understand that depression stems from both biological and psychosocial factors. It can be triggered by life events, stress, and genetic vulnerability. Brain chemical imbalances can be corrected through medication. Treatment options include medication, psychological therapy, and electroconvulsive therapy. Antidepressants take time, usually 2 weeks, to show effect. Side effects must be promptly discussed with the doctor. And medication must be continued even after symptoms improve, as decided by healthcare providers. Open communication is essential. Cultural beliefs must be respected, but patients should be guided toward evidence-based care. A supportive environment is vital for recovery. Depressed individuals may struggle with low self-esteem, lack of energy, and ongoing stress. Family and friends can help by offering emotional support, sharing responsibilities, encouraging participation in daily activities. In some cases, admission provides a temporary escape from stressors and allows for closer monitoring and care. Risk assessment is a continuous process. If a patient is at high risk of suicide or harming others, hospitalization is mandatory. Inpatient care must include close monitoring, safe surroundings, restricted access to sharp objects or ligature points. Even in non-psychiatric settings, staff must be alert to suicide risks. For those managed at home, families should remain vigilant. They must restrict access to wells, pesticides, railway tracks, and medication. Rarely, psychotic depression can pose risks to others, especially young children. Delusions such as "my family would be better off," dead signal urgent admission. Some severely depressed patients neglect basic needs like eating and drinking. This is especially dangerous for elderly individuals or those with little social support. Such cases require inpatient care, hydration, and in many situations, electroconvulsive therapy due to its rapid response. Managing depression goes far beyond prescribing medication. It requires a holistic approach that considers the individual's social, emotional, and physical well-being. Educate, support, monitor, and follow through. With compassion and clinical insight, recovery is within reach. Thank you for watching White Coat Voices. Please like, share, and subscribe for more content on medical care and mental health.